If it's your first baby, you probably have no idea how much you'll love that baby. Just don't know till they come out. But ask any mother, because they'll tell you.
Motherhood means to me nurturing and caring for and loving your children.
If you've never had children, or even if you have 2 children and you're having another one, it's still just amazing. It's this little life form and it's a part of you.
There seems to be an idea that if I'm smart enough or cute enough or rich enough, I can drink a little bit.
Any ingestion of alcohol at any time during the pregnancy can be toxic to the fetal brain.
Addiction is cunning, baffling, and powerful.
Even without the smoking, you can still have an issue with your child's health.
The fetal brain develops during the entire course of pregnancy.
If it's cigarettes, pot, acid, meth, alcohol, it's all the same. If they're exposed to it, they're getting hurt by it.
Later on, if there is a problem that develops, I feel like, for me, I would never forgive myself.
If I were to say that, eating chocolate cupcakes could cause your child to have lifelong problems, well, most people would give that up and never look back.
It wasn't truly understood until relatively recently that any ingestion of alcohol at any time during the pregnancy can be toxic to the fetal brain. The effects, particularly on the midbrain of the baby, is dramatic. And think of the midbrain as if you're thinking of 2 computers that are connected to one another, the left side of your brain and your right side of your brain. The midbrain is that portion of the brain where all the wires are that connects the left hemisphere with the right hemisphere. And the reason that they don't develop right in someone who's abusing alcohol at that particular time of the pregnancy is those cells are killed. They die off from just the poison of alcohol. Alcohol is a poison to the brain.
What we understand today is that there is no safe amount of alcohol, no safe type of alcohol product. There's no safe time to drink during pregnancy. My second daughter was born in 1973, which is when the literature came out describing the fetal alcohol syndrome. And unfortunately, I drank, and, years went on, and, drank again with my third child, but no one ever mentioned I shouldn't drink. It took me a few years, but certainly I understand today that my daughter, Carly, who is profoundly affected, wasn't just a kid with an ear infection who was going to grow out of her ear infection, wasn't a kid who was going to catch up, or, she wasn't a child who was just acting out because she was upset with my lifestyle, as one psychologist had written about, wasn't a child with cerebral palsy, as a team of a geneticist diagnosed her with at age 9. She is a child with fetal alcohol syndrome.
My primary message to women is, if you are even thinking about getting pregnant, or if you are engaging in unprotected sex where you could get pregnant, do not drink alcohol. Alcohol is the most damaging of all of the other drugs combined. It will have the most detrimental lifelong effects on the unborn child. For men who are supporting women or with women, you are a part of the picture. You have a responsibility to protect this child as much as the woman does. And you've got to help by not participating in drinking with her, and to strongly encourage her not to drink if there is any possibility that she could become pregnant. And then certainly, once that she knows she's pregnant, to not consume any alcoholic beverage for the duration of the pregnancy. There is no known safe amount of alcohol. And even when our physicians might say it is okay to have 1 or 2 drinks a week, it is not okay to have 1 or 2 drinks a week, because we do not know the effects of that. What the message is that there is no known safe amount of alcohol ever during the pregnancy. It's not worth the risk. Don't drink.
It's important that people understand that there's no safe time to smoke during pregnancy, and the impact of smoking is every day that one is pregnant. One just has to reduce smoking to a zero limit.
Well, prior to my first pregnancy, I was a smoker and didn't really have any intentions on quitting. I was just a smoker, an avid smoker, smoked about a pack a day. And then I became pregnant with my first child, and it was easy, I just dropped it. Now, this pregnancy, I have my 3-year-old, and I'm healthier, but it is hard. It is hard every day. And then I'd slip, and then I'm thinking, oh no, I gotta put this out. What am I gonna do? And I would always put it out, but it did take a couple weeks for it to really kick in this time. But it's something I battle with all the time. What does make it easier is knowing that I didn't smoke during my first pregnancy, and she still had health issues. I like being pregnant because I've got my, my child's growing inside of me, but it is hard. It's definitely not easy.
Everyone knows that drugs are bad. Street drugs are bad. Prescription drug abuse is bad. And the impact on the pregnancy is similar to what the other substance abuses can cause, such as alcohol and tobacco, in the impact on growth of the baby. It can impact on the mom's ability to take proper nutrition that results in nutritional problems and growth problems with the babies. Babies of mothers that are addicted to substances are born addicted to those substances and have to be withdrawn, and those withdrawal efforts are risky. The absolute spectra of injury to a fetus during the course of a drugged pregnancy are a little harder to define than alcohol is, for instance, and yet we do know that these babies have, again, significant problems during their developmental stages and after birth that are both emotional, physical, and mental as far as development is concerned.
When my first daughter was born, didn't really use very much. Didn't use it all when I was pregnant with her, very rarely when she was younger. And then later on, around 30 years old, I tried meth for the first time, and that became my drug of choice. And that almost instantly, I was using that daily. I found out I was pregnant. It was real early, like 2 months in the pregnancy. And I had used a little bit, but as soon as I found out, I almost immediately went to jail. And I would like to think I would have stopped using anyway, but I know that going to jail and then going straight from there to the treatment center definitely probably helped me be able to achieve that goal, and I didn't end up using for the rest of my pregnancy or since. So that's been about 14 months. My daughter's, I've been clean 14 months actually as of tomorrow. So, and my daughter just turned 6 months about a week or two ago. So she was born totally healthy. I feel extremely lucky that I was able to stop using before my infant was born, before my youngest daughter was born.
My daughter Michaela, she's 2. I used when I was pregnant with her. About 3 months straight I used. Didn't take care of myself, wasn't eating, wasn't doing the things I needed to do to make her be healthy inside of me. With my son, I used, not gonna lie, my whole pregnancy I used marijuana. And right to the end of my pregnancy before I had him, I stopped using. Because, I knew they would test me or they would test the baby and they would find it. And, he was born preemie. He had premature lungs and he had jaundice. And the premature lungs came from the marijuana and the nicotine. If I can, turn back and go back to when I was pregnant with my daughter, I would have never got high, never got high.
There's no question that these substances are injurious to pregnancy. These substances can be avoided totally and should be. And there's a lot of scientific evidence to suggest that. It's all about healthy lifestyle. It's all about, if you have a healthy lifestyle, if you do all the right things for yourself, including exercise and nutrition and avoidance of adverse substances during your life, then a pregnancy is a piece of cake for you along those lines. You don't have to change your lifestyle.
If you find yourself pregnant and there has been some alcohol exposure, you know, then what I like to suggest is don't drink anymore and just take really good care of yourself and, you know, try to make it a happy pregnancy.
There is always a positive impact from stopping this type of behavior with abuse of substances.
If you are pregnant and you are still using, then all you have to do is ask for help and you will get help.
There's programs out there for you.
If there's anything that I could say to anyone that's pregnant, battling any kind of addiction, whether it's smoking, drinking, drugs, caffeine, anything, I would say just don't give up. As long as you don't give up, the reward in the end is worth more than anything in the world.